Bismillahirrahmanirrahim. Assalamu alaikum. I am Professor Dr. Rafiq Ahmad. We are discussing the endocrine hormones. Previously, we discussed the parathyroid hormone and the overactivity, that is the hyperparathyroidism. And today we will discuss the underactivity, that is the hypoparathyroidism. Hypo and hyper both are important because it has very serious effects on the function of the body. Both conditions are treatable, but important thing is that you have to diagnose it early. Then definitely the results are good. But sometimes the conditions are difficult to diagnose because of various reasons, non-specific symptoms. Now the hypoparathyroidism, word indicates hypo means less activity of the parathyroid gland. Sorry. Causes congenital and acquired, that is the surgery of the thyroid gland, and sometimes, because I told you previously, these are very small glands. So whenever there is surgery, surgeon cannot identify and he removes all thyroid glands, parathyroid glands with the thyroid gland. And post-operatively, patient develops hypocalcemia and tetany and other problems. Some infiltrative disease like Wilson disease, there's a deposition of the copper in the parathyroids and cause destruction. Hemochromatosis, iron deposit is abnormal here, and it's not a normal area of the deposition of the iron, but when there is excessive amount of the iron present in the body, there are different areas where iron is abnormally deposited. One of these parathyroid glands and cause destruction. Granulomas, lot of disease produce the granulomas, and they are causing the destruction of the parathyroid glands. Autoimmune is the most common problem of the parathyroids that lead to the problem of the hypoparathyroidism. Now, autoimmune disease may be isolated to affects the parathyroid, but usually may be associated with some other disease like celiac disease, like diabetes mellitus, and other connective disorders. There are different terms used with the pseudo hypoparathyroidism. Now, pseudo means false. So, what is here that this is present due to the hypocalcemia is due to renal resistance and the PTH. Actually, PTH is secreted normally, but it cannot act. It is not able to act on the kidney, produce the vitamin D3. That's why it's called pseudo hypoparathyroidism. Another term is pseudo hypoparathyroidism. This is a genetic disorder which is not so common, but you can differentiate that. Usually start from the children, pseudo hypoparathyroidism. Now, actually, this is a pathophysiology. What happens there? What is the problem in acute hypoparathyroidism, especially? The cause of the acute hypothyroidism include injury to the glands, may be accidental, removal of the parathyroid glands during thyroidectomy or other neck surgery, autoimmune disease, tumor, tuberculosis, sarcoidosis, hemochromatosis, and severe magnesium deficiency associated with alcoholism and intestinal metabolism. Now, sometimes hypocalcemia may be due to magnesium deficiency because magnesium is essential for the absorption. So calcium may be normal, intake everything, but because of when you advise investigation, everything will be normal. So you may think about that it may be due to magnesium deficiency, and this may be associated with alcoholism and intestinal malabsorption. These disorders and conditions cause a cascade of effects that result in severe hypocalcemia and hyperphosphatemia, which can lead to the seizures, tetany, laryngospasm, and central nervous system disorder abnormalities known as the shown in this flow chart. So causes, positive factor, gland injury, accidental, what we have discussed here, Diminished or absent parathyroid hormone levels can lead to the excessive reabsorption of the phosphate by the renal tubules that leads to hypocalcemia and that leads to seizures, tetany, laryngospasm, and CNS abnormalities. Diminished or absent parathyroid hormone levels can lead to the decreased release of the calcium from bones and that leads to hypocalcemia, and hypocalcemia leads to the signs symptoms of the acute problem. Sometimes it's called tetany. So seizures, tetany, laryngospasm, and CNS abnormalities. Now, diminished or absent parathyroid hormone levels can lead to decreased renal reabsorption, the calcium. That's also leads to hypocalcemia. Decreased intestinal calcium absorption. That's because of due to decreased absent parathyroid hormone. These are four factors which are responsible for the hypocalcemia, and hypocalcemia, if it is acute, can lead to the tetany. So tetany is present with usually the different signs symptoms of telling there is spasm of the muscles. I will discuss. So seizures, tetany, laryngospasm, and CNS. This is the pathophysiology, how the patient develops this problem in acute stage. Now the clinical manifestations or clinical features, acute tetany. So there will be usually there is spasm of the muscles, but especially the facial muscles and hands. There is severe pain. The patient has muscle cramps, irritability, corporal spasm, convulsions, tingling on the hand and feet. Chronic, the usually patient can have lethargy, personality changes, anxiety state, coloring vision due to the cataracts, Parkinsonism, and mental retardation. If there is in a young age, children, it's called mental retardation. This is a bone scan. This also sometimes can lead to the calcification of these MCI, especially the basal ganglia, that can lead to the Parkinsonism. This is called carpopedal spasm. Now here can you see that when this house produced, the cuff, epiapratus cuff is inflated, the pressure, and remain for 1 or 2 minutes. Then if there is hypocalcemia, this picture will be there. There is a just like spasm of the muscles of the hand. This test is called spasm. Now this is called streak sign. This is also seen in the hypercalcemia. So hypocalcemia is begin by telling the patient relax his facial muscles, how it is elicited, then stand directly in front of them and tap the facial nerve either just anterior to the ear lip and below the zygomatic arch and the corner of this mouth. The positive response varies from twitching of the lip at the corner of the mouth, spasm all facial muscles that side, depending upon the severity of the hypocalcemia. So this is called streak sign, not cervix, but it's streak sign. So two important signs are important. One is the this streak sign, other is the carpal spasm. Now there are two other terms used, similar terms like tetanus. Tetanus and tetany are different things. Tetanus is produced by the organism, that is anaerobic organism, that is called Clostridium balcea, and this occurs due post injury, any injury then followed by this problem. And this is the different types of the tetanus are there. There is the cephalic generalized, in which there is a continuous spasm of the muscles bilaterally, and there is sometimes there is fits, but there is asynchronous patient. If you give a stimulus, patient will have continuous. Whole body becomes rigid and is difficult opening of the mouth. But here it is nothing. Here is different stage. So these are the congenital problems due to the hypoparathyroidism. Congenital children, retarded growth, different teeth. You can see how. So where there may be cataract formation, small hands, so hands become small, mentally they are retarded, intellectual impairment, bones are small, deficient, weak. Here you can see the bones are small and they are not fully mineralized. They are become weak. You can see here. Now, there are other term that is the osteomalacia. We'll discuss later osteomalacia that also due to hypochondria, but there are other factors also. These are the legs become curved. They cannot then due to pressure. Now, after having suspicious of the hypoparathyroidism, you go for confirmation. What is really the hypoparathyroidism and what is the reason? So you go for the PTS level. This is a very specific test that definitely will be low. Now serum calcium definitely will be low. And serum phosphorus will be high. Urinary calcium will be low. Now calcium is quite variable because it depends upon the level of the albumin. If patient has liver disease, patient has renal problem, totally enteropathy, the albumin is low, the definite calcium will be low, but we have the formula that's called corrected calcium. So by corrected, when these situations arise, we does not rely on the serum calcium, but we advise corrected serum calcium. So if that is low, then it's confirmation the patient has hypocalcemia. Now hypocalcemia, if it is, there are so many reasons. Vitamin D deficiency can lead hypocalcemia, but here definitely we will take help from the PTH level. So if the parathyroid hormone level is low, it seems the patient has serum calcium low because of the hypoparathyroidism. Alkaline phosphate is normal because alkaline phosphate is raised when there is a fracture. Here there is no fracture. It's just like the demineralization of the bone. So the alkaline phosphate remains normal. The CT scan of the neck definitely helps. Bone radiographs also helpful. ECG is very helpful. That shows the confirms the hypoglycemia. ECG will be QT interval will be prolonged. There may be arrhythmia. Sometimes there will be blocks. So you can see also indirect evidence of the hypocalcemia. Now if you go for the treatment, definitely there are two types of treatment. One is the chronic and acute. When patient has tetany, that's called emergency. So we have to admit the patient, we have to maintain airway and give intravenous calcium gluconate 10%. Given in the 10 to 20 ml slowly, and then you have to put in the 1 liter, and you can maintain the calcium level. Because oral calcium will not help at that time. It's an emergency. We have to give intravenous calcium gluconate, and you will see the results are very good. Oral calcium, magnesium, this should be given for maintenance when we give diagnose and you want to maintain. Then the definite treatment is transplantation of the parathyroid tissue. Very important that when the patient are diagnosed having the parathyroid problem, then we have to give the transplantation of the parathyroid tissue. Then there is another way to treat these patients, that is the parathyroid hormone synthesized. DNA technique, they synthesize parathyroid hormone that should be given to parathyroid, but this should be given subcutaneously BD and maybe for whole life. But the problem is that these hormones sometimes can lead to the osteosarcoma. So we have to discuss with the patient that this may be the possibility. Otherwise, patient will blame you. And on the other hand, yeah, you have treated by this problem, but you have created another problem, that is the osteosarcoma. Still, WHO has warning that if you think that patient is not corresponding to the oral calcium, magnesium, or vitamin D, then if the remains low, serum remains less than 7 or 6, and the patient is symptomatic, then you have to give this drug, but keeping in view that it can lead to the long-term osteosarcoma. So these are the maintenance dose which have to be given for whole life. It's important. So vitamin D form is available. Spare vitamin D3 is more important to be given here. The different types of vitamin D are available, either D2, D3, or in simple vitamin D. So if you give her vitamin D3, it's costly. Vitamin D simple is very cheap. So there are capsules available. Vitamin D3, 50,000 international units are available commercially in the United States. They become compounded. In here, they are available in Pakistan. So we have to give 10 lakhs 50,000 units, and this is a daily dose for 4 to 6 weeks, and then you have to go for maintenance dose. Either you can give calcitrol, rofaltrol. This is also free form. This can be available, so this can be given because simple vitamin D sometimes will not help. So either should be given vitamin D3, that's very helpful. And when you can advise periodically the levels of vitamin D3 because hypervitaminosis is also dangerous for the patient. So it should be remain at normal levels. So vitamin D and calcium should be given in these patients for whole life. And sometimes if they need emergency uh, situation, then IV calcium can also be recommended. So this was all about the hypothyroidism. Thank you very much. And now I will take your questions. Any question? Question. So we will unmute, but one by one, not all at the same time. Question.